All right, well, good afternoon. My name is Chris Rowena. I'm the lead communications analyst at Health Workforce Development. We're excited that you've joined us today for this HCAI Certified Wellness Coach Employer Support Grant Program Office Hour. That's a mouthful, but we're here to answer your questions today. Before we begin, I would like to discuss a few housekeeping items. All right. This office hour is hosted in Microsoft Teams. If you are not familiar with the platform, you can find the view controls and the chat feature in the menu bar at the top of your screens. This office hour will be recorded and posted on our website in approximately 7 to 10 business days. This office hour will focus only on application-specific questions for the HCAI Certified Wellness Coach Employer Support Program Grant. We do ask that if you have other questions related to wellness coaches that you email us, and we will provide that email address in the chat. And then lastly, program resources are pinned in the chat for easy reference today. And with that, we're going to jump in. Today, I will be the facilitator. Our panelists today for the office hours are Ann Powell, our health program specialist too, and Christian Jones, state policy analyst. We're going to conduct this pretty informally. Here's how it's going to work. You have two options for asking questions. One, you can go to the top of your menu bar, click on the chat bubble up the top, and you can type in your questions using the chat box. And the second option is that you can raise your hand up at the top right next to the chat button there and wait to be called on. We will call on people in the order that we receive, and we will be going back and forth between answering a chat option, a chat question, and a hand raised question. We do ask that you limit your questions to 2 minutes or less. And we are going to do our best to get through all the questions you have today and get you guys on your way to successfully submitting your application. So with that, questions are open and we are ready to start getting into it. So Sarah has the first question here. When do you anticipate that certification programs will be up to ensure there are staff to hire summer of 2024?
So the certification portal for which you can get people certified is already open. We will have that linked to you in the resources in the chat. The education programs for which people can be educated to become a certified wellness coach, they are currently live in the sense that our first phase of our certification process is live. So people with certain degrees are currently eligible to be certified under two different pathways, the education pathway and the workforce pathway. And we have information for that process linked in the resources.
All right, thank you, Christian. Next question, Crystal asks, can you please clarify what documentation is needed to prove a school is Title I?
A copy of your letter or other official document that references your Title I status is totally adequate.
Thank you, Ann. Sarah asks, is there a current pool of wellness coaches ready for employment?
We are building that pool for you right now through the open certification website. We had, at last count, over 1,000 people who had opened the website. I don't have a number for how many secured certification, but it's an important feature that we know is critical to your success, and we're working to promote the program and certification.
All right, thank you, Ann. Next question, Peter asks, our COE does not currently employ wellness coaches. With the grant, do we submit the number of BWCs we would like to hire and write the grant for that number? If we do not hire that number, do we have the option to return the funding?
You do have the option of either not accepting your grant or notifying us that you're only going to spend a certain amount. I want to go back to the other part of your question. When you say the number of BWCs, you mean certified wellness coaches, and we would ask that you identify that number and include that number in your application, as well as the sites at which they will work.
All right, thank you, Ann. Next question, let's see here. Cynthia asks, regarding the questions about each school site, are you looking for total enrollment when you ask for on average how many children are served?
This would depend on whether that CWC will be servicing the whole student population. If the answer is yes, that CWC is available to any student who needs them, then yes, we are looking for the total number of enrollment at that school. However, if you have a targeted program that's only targeted towards certain students at the school, we would be looking for that number.
Okay. Thank you. And Peter, I noticed.
Let me add to Christian's answer that it would also be good for you to note that in your description in the beginning of the application so that we understand who you're targeting. Thanks.
Thank you, Ann, for that clarification. Peter, I did notice that you raised your hand. If you do still have a question that needs answered, you can go ahead and raise your hand again, and we will call on you. Again, two different ways you can ask answers in the, or ask for questions in the chat, or you can raise your hand in particular if you have a, there we are. So yeah, let's go ahead and call on Peter here.
Okay, I'll try to make this brief. Well, one, is this going to be the only round of grants? I think is one of the questions that we have. But the thing is with our rural schools, we don't have people that probably qualify to be certified immediately out of the gate. So there'll be some supervision required to get them certified to the degree so that they can be on the fee schedule. We do have a mental health grant here in Humboldt County where we have navigators, and the work that they do is very similar to wellness coaches, but we do need to look at those criteria. And I know that you'll be the certifying body to then get them up to their hours, whether they're behavioral wellness coach 1 or 2. Right. So there's that. So there's going to be that period of time, but we also serve quite a few sites. So what we would like to do is probably regionalize this service some so that the tier 1 and tier 2 intervention could be available to a number, like one wellness coach would probably be at several sites is the idea, and supervised in-house here by the COE. So there's just that. And then that's probably enough, but I do have another question as
well. Well, let me give it a try. Okay. We have been speaking with individuals from rural areas, and we understand and we're familiar with the MHSSA grant that I think you're referring to. And it is our hope, I won't say expectation, but hope that the work that they're doing looks a lot like what a wellness coach is doing, and that they meet the basic certification requirements. And for that, I would encourage you to go to that CAWellnessCoach.org website, where it lists out the different pathways for certification, workforce versus education, because they would probably qualify under the workforce pathway, which is a little more flexible in regards to degrees. And so take a look at that. On the question of sites, I think the reason we ask for a listing of the sites where you anticipate your wellness coaches would work is that, and whether or not that's a Title I site, is that we give points in the scoring based on the proportion of sites that are Title I schools. Rural areas will also get acknowledgement in the scoring because we recognize, as you described, the difficulties of finding people to work in those areas that meet the qualifications. So our goal is to assure statewide-ness with our program, and so we will definitely be looking at whether or not an applicant is from a rural area. I hope that helps.
I do want to add, just to answer the first part of your question, that we only anticipate one round of funding. We do not anticipate another grant being launched next year because we hope that there's enough uptake on the Medi-Cal reimbursement side that these positions will be sustainable through the future.
Mm-hmm. Did you have other questions, Peter?
I do, but it's eluding me right now. I want to do it articulately, but I'll raise my hand again. Thank you so much.
Okay.
There are many questions, but I want to give other people.
Thank you.
Thank you, Peter. Thank you, Ann and Christian. Next question from the chat. Sarah asks, can you clarify the certified wellness coach supervision funding and intended use, as well as the intern role is and what the stipend covers?
So the funding for the supervision is for school or agency staff support necessary to supervise these new personnel. We recognize you can't necessarily absorb this responsibility with your current resources. So we help subsidize that activity with funding associated with a number of wellness coaches that you seek funding for. And the intern role is really to accrue the necessary hours to be a certified wellness coach. Interns in our grant application or grant guide, as you will note, are individuals who are what we call registered certified wellness coaches, which are individuals who need to earn additional work experience hours to meet certification without that registered status. The stipend is intended to help offset whatever costs you incur by having that individual on your site.
All right, thank you, Ann. Next question, we're going to go to the hand raised, Rocio Herrera.
Hi, good afternoon. I have a quick question. We are a community-based organization working with a particular school district on 6 different high schools. Are we able to submit one letter with all 6 schools listed, or do we need 6 individual letters?
One letter would be fine, especially if it's an LEA or COE that all those individual campuses are associated with. Yes.
Okay, perfect. Thank you.
Thank you, Rocio. All right, next question from the chat. If a CBO is the applicant, are letters, documentation from the LEA and COE required?
Only the COE, yeah.
Yeah.
If it's multiple LEAs, so if you're like, say it's 5 LEAs, you can just get one from the COE. If for some reason that's troublesome, you could get them all from the individual LEAs, but obviously the COE would be easier.
All right, thank you. All right, and next hand raised question, Linnea?
It's Lanye, like Kanye.
Lanye, I love that. Hi, Lanye.
Hi, greetings. So I had a question about supervision. So
Yes.
I don't know if any of you are clinicians or in the behavioral health space, but it's very hard to get supervision post-grad or even in grad school. So site supervision in colleges is usually someone with an MSW, 2 years post-grad work, they can supervise on site. But I noticed in the grant guide, you were referencing licensed clinicians for bachelor and associate level individuals. And in the industry, that's not standard. So I just wanted to know if you could clarify that piece.
The important distinction is that these individuals are not providing clinical services. So you're not, I'm an MSW, so I have some familiarity with what you're describing. And were I earning hours and need supervision, I would be doing clinical work. However, these people are doing preclinical, primary prevention, early intervention, no crisis intervention kind of work. For example, if they see a clinical need, they refer that child or youth to a clinician.
Correct. So the
Yeah.
supervision of the wellness coaches in the grant guide, it mentions licensed professionals.
That's
and
right. It could
yes.
be either. Yes.
So it could be an MSW post-grad hours or licensed professional or an LPCS. Correct.
The exact wording in the grant guide for us is it could be a PPS credentialed individual. We, as you point out, we call out licensed clinicians or personnel trained to supervise individuals providing primary and early intervention BH services. So those categories are going to be filled in at the local level. In line with local regulations. The space is quite complicated, so that's where we put the line in our grant guide, and we're going to leave it up to local education agencies and local community organizations to figure out what that means, complying with their local regulations.
Thanks,
Perfect. Thank you
Kristen.
so much.
Thank you. All right, next question from the chat. For those of us in rural counties, will not writing for max of 40 coaches disqualify or affect our points?
Nominally, only in the sense that, yes, we do in the scoring give up to a certain amount of points, 40 points, I believe it is, for that count. However, again, we're compensating for the difference in rural areas through other mechanisms so that it evens out in the scoring. There are other circumstances or criteria in the scoring criteria that may or may not apply. For example, the Title I proportion of your sites.
All right, thank you, Anne. I see a comment in the chat asking for connections. That's great. We love it when you guys connect and partner up. And our recent grant guides did discuss how to do that. Next question, how are you wanting us to define behavioral health staff? Is this anyone who is currently providing Tier 1 or Tier 2 services?
Yes, so Tier 1, Tier 2 in the nomenclature is that primary prevention and early intervention work that would be appropriate. So behavioral health staff, how are you wanting us to define behavioral health staff? I'm not sure what the reference is. Christian, does that mean anything to you?
We do ask them about behavioral health staff. This is how you define behavioral health staff in your organization. We don't have a centralized definition of what that means. We want you to give us what you mean by behavioral health staff.
Right, that's right.
I do see Cynthia raise her hand. So
Yeah,
Cynthia,
I asked that question because in that drop down when you're asking for demographics about each school site, so we are CBO partnering with a school, so they may have their own staff that come onto the site. We have Tier 1 and Tier 2 as well as clinicians going onto the site. So you just want us to do like an FTE of what our best guess about how many providers are coming onto that campus?
We're looking for the number of providers that you employ,
Okay.
not the site count.
And then when you're asking the question about total number of staff at the school sites, are you asking for school personnel? Like I was confused by those questions.
Yeah, it does tend to focus on the school site because that's been the primary emphasis of the grant program is education providers. But for your purposes, it would be the total number of individuals you have at the school site. So you may have health staff as well as behavioral health staff. So it would be that general total that we'd be looking for.
Yeah, so for the first question, you don't want us to put in like the number of teachers and secretaries and all that. You just want any staff we have at the site. And then the second question specific to behavioral health, you want just behavioral health providers that we might have at the site.
Correct.
Okay. And then total enrollment of the school or whatever population we're going to serve, whatever subset in the third
That's
question.
right. That's right.
Gotcha. Thank you.
Thank you, Cynthia. Next question from the chat. Can the wellness coaches covered under this grant provide services to both an organization's program participants and an organization's staff?
Yes, if the staff is below the age of 26, so if they're 25 and younger, they would be qualified to do that. But we only certify them to provide services for those aged 25 and younger. So I imagine some of your staff might be above that age, and maybe you can write the job in that way, but we cannot certify that they would be able to do that based on the certification process we've constructed.
Right. Ron, if you're available, maybe you could provide some clarity about that question through the raising your hand at some point. Go ahead, Chris.
All right. Next hand raiser, we've got Lexi.
Hi, thank you for taking my question. I just want to thank Michelle with HCAI. She has been helping me so much with the grant because I've had so many questions.
Oh, you're welcome. I'm on the call.
So thank you, Michelle. She's probably tired of seeing me pop up in her inbox.
I recognize your name.
One of the questions that I had, and I think Cynthia was kind of pointing to it as well, is the BH staff that you asked for in the application. I have, for example, one BHT that floats between two different sites. So technically it's like a 0.5, which the system does not allow. So should I keep that as a 1? That's the first question.
Yes.
Okay, perfect. And then the second question is, and this one caught me off guard, so I'm trying to figure this out. How many languages does your staff speak across all sites? Are you referring to the behavioral health staff, or are you referring to everyone we employ as a district?
All your staff.
Yeah.
So everyone.
Yeah, Lexi, the way that question's worded is it's a mistake. We would correct it if our system is allowed. The way you want to answer that question is you have your total number of staff. Say you have 100 staff, and of them 56 speak Spanish. You would put 56 for the Spanish language. If 3 of them speak Arabic, you put 3 for Arabic. If no one on your staff speaks Ukrainian, put 0.
Perfect. So thank you. That is super, super helpful.
Yeah.
Great.
All right. Thank you, Lexi. All right. Next question from the chat from Beverly. Will existing employees who move into wellness coach positions based on experience be required to get formally certified as a wellness coach at a later date?
They will be required to be certified in order to receive grant funding.
All right, thank you. And next question from the hand raisers, we've got Tham Lee. If I mispronounced that.
Yeah, my name is Tham Lee from Vivo. We serving the community, actually, the underserved population. And this funding year, our grant ended on June 30 due to the new change. We're supposed to have, until 26, but we know that we will be ending on June 30. And at our service, the population, we have a hard time to have the family access to mental health, the children, no tutoring, not go to school, and they are more. However, we just came back from COVID. We have been here for a long time, but since the COVID, we closed, and right now we want to know, can we qualify to apply for this grant for the underserved population in San Joaquin County? Thank you.
Only if your services are provided specifically in association with an education entity like a grammar school or middle school or high school. So the idea is that you would be serving students up through age 25, which means you could also be affiliated with a community college, for example.
Yeah, thank you.
Mm-hmm.
Thank you. We will develop on that. Thank you so much.
Thank you for your question. All right, next question from the chat. If a school is a charter not authorized by the county, are they still required to get a letter from the COE?
Let me look at the question again.
So you
don't, you need to be a public charter school. If you're not a public charter school, you're not eligible.
All right.
If you and charter schools are not required to get letters if they're if they're eligible, because that's considered educational institution.
All right, thank you. Laura asks, can AA or BA level staff that provide CWC activities in wraparound and full service partnership be included in this grant? They provide wellness activities in the home, school, and community.
As long as they're eligible for certification. So it would depend on the specific associate's degrees and bachelor's degrees that they hold. And I would encourage you to walk them through the Wellness Coach website that we have linked in the resources to see if they're eligible.
Right. As to the providing it in the school or in the community, once you assure that your workforce are can be certified, then they can deliver services anywhere.
All right, next question. I understand that HCAI's goal is to ensure CWC services are provided across the state. What criteria will you use to determine if a rural applicant would take precedence over other applicants? Curious if that criteria has been established for how this determination will be made.
So we're going to take the scoring criteria listed in the grant, and then we're going to score applications, and that'll be a first scoring background. And then we'll see if we awarded purely on that scoring criteria, what would the geographic distribution of the funds that we're distributing be? If we notice that whole areas of the state are not receiving funding, we will adjust from there so that there is statewide distribution of funds.
All right. Thank you, Christian. And I see we got another hand raised, Esquiel.
Okay. Hello, hi. I also posted that next question there in the chat, but I thought about it. Another question. So first is the question on the chat, which is how do you qualify whether a staff's work experience hours count for certification? So we employ education community workers that work on school sites, providing services to students and families, particularly connecting them and linking them to services. So if they have the appropriate degree, would that work count as towards certification?
Yes. Again, as we've mentioned earlier, we ask you to look very carefully at the certification qualifications to determine if you're eligible to apply for certification.
Perfect. And then the second part of that question, just really quickly, is we're also applying for CCSPP funding for certain sites for community schools. And and we're hoping to also employ CWCs to support those sites, but we haven't hired those positions. So can we apply for funding for those future positions?
This is for positions this budget year. It's an 18-month application, so it would apply for the fall of 2024 through spring of 2026. Or March of 2026. It's a one-time application. And so the expectation is the staff would be hired now or as soon as the grant is executed. And we can't anticipate future grant opportunities. And keep in mind, community health workers, as a rule, would not qualify for this for certified wellness coach. If they would, we strongly urge you to get them certified because of the new all-payer or multi-payer fee schedule.
Yeah, no, we definitely expect them to, and award notifications come out next month. So I'm hoping that, that's what I was asking, so I'm hoping that we get funded for all the schools that we
Good.
applied for, so thank you very much.
You're welcome.
And just something I want to add as far as like the hiring schedule, because we've had multiple questions about this. It's an 18-month grant period, but you do have to employ any CWC you hire for a minimum of 10 months. So the absolute latest you could hire for any of the positions that you apply for is the 8th month of the grant period.
All right, thank you, Christian. That's a good call out. Next question. Can you explain what exactly is expected from a letter of sustainability?
We require that you tell us how you're going to sustain these wellness coaches past the period of the grant. There's many ways in which you can do this. The primary way that we foresee you doing this is through the Medi-Cal reimbursement and through the multi-payer fee schedule. But if that's not the case, we just expect a letter of you telling us how you're going to sustain these CWCs past the grant period.
All right.
For example, Medi-Cal billing.
Mm-hmm. Of one of many, but that's the primary one that we expect to see.
All right, back to the hand raisers. Lanya, you're back. Lanya, are you there?
Yes, I am. That was an accident. I'm apologies.
No
Okay.
worries. Is the hand raising was an accident? I think so.
Yes.
Okay, then we'll go to Rocio. You're back as well.
I am back. Thank you. I actually had a couple of questions. You mentioned there was a question earlier about languages. So we're an agency that provides a variety of services, gang intervention, domestic violence, variety of programs. If we're an agency of, say, 140 people, but only we're 30 of our staff would be certified, you want the language of the 140 staff or just the 30?
140 staff.
Okay. Okay, and then I may have missed it on the website, but where do we upload the letter of commitments?
The letter of sustainability.
Well, there's the letter of sustainability and then there's the letter of partnership, I'm sorry, with the school.
Okay, so we're going to ask you to email that letter to us we'll figure out the email address and get back to you.
The letters,
Before the end.
the letters should be uploaded on the application too. So there's like the last page is where you upload all of them.
Yeah. The last page of the application is where you upload required documentation. If for some reason that's unavailable to you, please email us. You can either email the letter at the wellness coach email. It should be slide 6 of our current deck that we have up. You can either email that email for assistance in the application or just directly send the letter to the email.
Yeah, that option wasn't on the application.
Mm-hmm.
Yeah, I didn't think it was.
Okay.
So yes, email wellnesscoach.hci.ca.gov.
Mm-hmm.
Okay, so we can email those to you. And then I believe someone had mentioned that there would be a sample provided of the letter of sustainability. Is that still available?
I apologize. I will get that up in the next day.
Okay, thank you so much. I appreciate it.
All right, Rocio, thank you so much. Next question from the chat. Is there a statewide campaign working with community colleges and other post-secondary institutions to best guide their students to prepare for this new statewide position?
Yes, there is. Well, yes and no. We are undertaking to work with community colleges and four-year social work programs to develop curriculum that aligns with the competencies of a wellness coach. We want to be sure that when you're in school that you get the right courses so that you meet the competencies when you apply for certification. That work is just beginning, and we hope to have several social work programs as well as community college programs designated this coming fall. We're not doing any work directly with prospective students for those programs. Rather, we will have a scholarship program, and we're looking at other supportive ideas for these students once they are funded with scholarship funding later this year.
All right, thank you, Anne. All right, next hand raiser, Jill Barnes.
Thanks, Christopher. My question is also in the chat, and I apologize if you guys have already covered this. It's around the calculation for the salary and benefits as it relates to the count of certified wellness coaches in the application on the portal. Is the total calculated for a 12-month period or an 18-month period? Because it does cross over fiscal years. If I have one wellness coach and I put them into the portal, is it going to give me enough to cover that contract in just 24-25 fiscal year? Or will it essentially give me a year and a half to get me through the second half of 25-26 or the first half of 25-26 contract year?
It's an annual figure, so you should adjust your count on an annual basis.
Can you clarify that for me, Anne?
So if you are going to employ a wellness coach for 18 months, that would be 1.5 positions.
Okay,
because
so
it's
if I
annualized.
So
yeah.
just put in, if I have 40 wellness coaches, just put in 40 and it will multiply that by 1.5 for the.
No, the opposite. I'm saying the opposite.
Okay, so if I have 40 wellness coaches, put in 60.
Yes.
Okay, that makes sense. Thank you.
Good question.
Sure.
All right, thank you, Jill. Next question. The Title I school lookup.
I'm sorry, before you jump in, Chris, I do want to say, Jill, that it's also really important to remember that we are anticipating that grantees will want to get in place the reimbursement under the multi-payer fee schedule, and that once they start billing for those services, our grant funding would not cover that position. So you may apply for 18 months, but if the Medi-Cal billing, for example, Medi-Cal and private insurance, if that billing flows January 1 and you're in position to start billing against that, then your grant funding would stop.
Can I ask a quick follow-up, Anne?
Yeah.
Thank you. It's my understanding from the current DHCS draft guidance, though, that each individual provider will be required to have an NPI, which will take some time.
Exactly.
To process. So even if
yes.
we did get into a cohort in 2 or 3, starting in July or January, there's no guarantee that they would be bringing funds in and billing.
Right.
So.
Yeah, and that's why.
If we had additional grant funds left over, would that we just wouldn't invoice you for those funds in arrears, or?
Correct.
Okay.
Yes, correct. And that's why it's an 18-month versus a 12-month grant, is we anticipate it will take some time for the schools to get everything in place to start the full billing process. Go ahead, Chris. Sorry.
All right.
Yeah.
No, it's okay. That's why we're here. So I was actually just about to read Cynthia's question, and Cynthia raised her hand.
Yes.
Cynthia, do you want to go ahead and ask your question?
I have a follow-up question to that, because that was a little convoluted for me. So if we put in 60 and we're only hiring 40, that's going to inflate the number of FTEs for the points. One thing, like if you were only going to employ 15 or 20 wellness coaches, but you put in 30 because you're going to do the 18 months, you're going to potentially get more points in the scoring. So that's a little confusing for me in terms of equity, with schools that may be not planning on doing like the 18-month. And then
That's
I guess,
right.
so that's something I would ask you to consider when you're thinking about how you're doing that. Like, are we hiring 40? Are you really hiring 60? It's going to make it look like you're hiring more than you are. And then the question related to that I have related to the funding. So let's say we do get in cohort 2, we're transitioning an existing workforce into the wellness coach certification and aligning their work with the billing and all of that. And we're able to start billing in like in January, let's say we do that. So then we're not eligible for any portion of the funding. Like, let's say we're not billing 100% to sustain the position. So once we start billing, we cannot no longer access this funding. Is that what I heard you say, or no?
It's a question of double dipping. You can't be getting grant funds for something for which you are getting other revenues.
So yes, but it may not cover the entire cost of the person at first while we're gearing up billing. So would we be eligible for a percentage of the billing that if we can show the revenue we brought in to offset the cost? Because part of this is to help the workforce transition to this new system of payment. And so to me, it's bridge funding to help you get there. So I would think you don't want to disincentivize people from starting to bill. However, am I going to be able to have my workforce bill 100% starting the first month we start billing? Maybe not. So I don't know that you have an answer for that, but it's just something I have curiosity about that.
Through.
There could be a way that you show, like, we would definitely be able to show revenue that we bring in to offset our costs, but I was not anticipating we would be 100% covered by billing the first month we bill. That's not typically the way it works in this kind of a new system. So just that's my question or inquiry about the billing and eligibility. Because if not, then people might just, I don't want to linger on this funding any longer than I have to. It really is for us a bridge to get us to where we need to be in this new payment structure and getting our staff certified. But I also don't want to be out 50% of the cost of the person because they were only able to bill 50% in the first quarter of billing or something. So, and I'm just basing that on some of the other transitions our agency's going through in terms of mental health, behavioral health payment reform in the moderate to severe and other areas. So I have a baseline for it. Doesn't happen overnight. So.
Got it.
Okay, are we ready to move on?
So I think we appreciate your perspective, and I think we're going to do some more internal discussions about how to address what you're saying, as well as this 12 versus 18-month coverage.
We'll follow up with everybody here to make sure everybody's on the same page once we've internally had that discussion.
All right, thank you, everyone. Let's see, next question from the chat. The Title I school lookup doesn't seem to have a lot of individual schools listed. If we can't find the school in the search, the Title I verification will suffice, correct?
Yeah, that'll work.
Okay. Next one, once awarded, if they're not certified individuals, can organizations use the award amount to pay people's staff while they're in the certification program?
Did you reread that, Chris?
Yeah. Once awarded, if there are not certified individuals, can organizations use the award amount to pay people's staff while they're in the certification program?
So if you're talking about the money set aside specifically for CWC employees, those can only go towards certified wellness coaches that are certified at the time at which they are receiving funds. You could pay other staff through the certification if they're supervising wellness coaches. You could also pay staff that are registered certified wellness coaches, meaning wellness coaches who have a minimum of 150 hours of experience, but are not fully certified. They are registered certified wellness coaches. You can pay them using the intern stipend. But the main stipend, the big chunk of the grant, which is the CWC employee budget category, that can only be spent on certified wellness coaches that are certified at the time of receiving funds.
All right, thank you. Let's see. Next, oh, Peter, you've got your hand up. Go ahead.
Yeah, I'm sorry. The answer to that question just kind of threw me a little bit. So, Anne had mentioned that she was familiar with our program. We have navigators paid out of a MHSSA grant, which is a mental health and wellness grant here in Humboldt County that have been serving students. The COE has traditionally not employed behavioral wellness coaches. It's really been district staff and aides and support that we provide at the office and technical assistance and such. So this grant is coming up very quickly, and in our perception was that this grant was to help get people up and running so that they would be eligible for the fee schedule, so that we could build that workforce in the interim before the fee schedule gets up and going. So if within what I'm hearing, this grant is, due mid, 3 weeks, the only people that people have to be certified by the time we submit this grant to be able to be eligible for the grant. Is that what I'm hearing?
No. So what I was saying, so the grant has a bunch of different budget categories. So if you're telling us that you're going to be hiring 4 wellness coaches, when we're paying you that money for the wellness coaches, they actually do have to be certified wellness coaches. They cannot be some other staff that are not certified. You can hire the staff at any time during the grant period, but at minimum, they have to be employed for 10 months during the grant period. So you could hire them in the 7th month of the grant period, and then they would be employed continually for 10 months during the grant period, and you would receive funds for that.
The thing is,
they do not have to be certified right now at the time of grant submission, and they do not have to be certified when you sign your grant agreement.
Okay, but we cannot use grant funds to pay them until they are certified.
Correct.
Correct.
Okay, and then my next question is in the chat, so I'm just going to read it quick. But my question is, we have an organization locally that is a private organization. They're not a nonprofit community-based organization. They're the Humboldt Independent Practice Association. They have wellness centers all over our county. Could their staff that are, staffing these wellness centers, and they are, they're not licensed individuals, would they qualify under a private organization as behavioral wellness coaches?
It depends on you have to look at the certification.
But they could. If they qualified for this under the criteria, they would. They don't have to be. They can be part of a private organization.
Yes, nonprofit. If they're, well, let me clarify. So applicants have to be public or private nonprofit. If you turn around and contract with another entity to support your program, then we need to say, we need to make sure that you are responsible for that support. We're not asking for you to tell us all of, how do I say this? We want to know who else is part of your program, but we are not reimbursing that entity for the services you are.
Got you. But we could use grant funds to do that if they became certified.
Yes.
You could contract out with private organizations to provide for things, but crucially, we don't have, as HCAI, a relationship with that private organization. We have a relationship with you, and then you have a relationship with that organization, and you are responsible for the fulfillment of all the grant obligations. So I would just say, work with your legal team to make sure that whatever contract you write with the private organization is in line with your grant obligations.
Okay, thank you.
Yeah.
All right, thank you, Peter. Next question from the chat. I believe the governor's proposed 2024-25 budget includes continued funding for CWCES. Can you explain the intended use of these funds if the current budget language is enacted? since you just indicated future CWC grants won't be offered? Thank you.
So actually, what the governor said was that he supported certified wellness coaches. The funding for this has been awarded up through the current budget year, and that money is very specifically targeted for a host of activities under the Children and Youth Behavioral Health Initiative. The money that's been earmarked for this program is a one-time funding cycle. And there is no other money unless the governor decides to appropriate more funds than the 4.4 billion that has been allocated. It could be that technically there's a reappropriation, which happens all the time in the budget process. Budgets are very technical documents, but we have a specific amount that's been designated for this purpose. And that's what we figured out. We have enough for one funding cycle.
All right, thank you, Anne. All right, back to the hand raisers. Ezekiel.
Really quickly, typically, how long would you say the certification process takes if somebody's qualified?
It's an online application. There's no process other than completing the application. And I see what you're asking is how long will it take to hear back? I don't know that I don't have an answer to that. I don't know that Christian does. But so far it's not taking very long at all.
Yeah, what I can say is we opened the process 13 days ago and we already have certified coaches. So it's not a very long process at all.
Awesome. Thank you much.
Yeah.
All right. Thank you. Next question from the chat, from Laura. Can someone provide tier 3 interventions?
That's an Ann question.
I'm sorry. I have somebody in my asking me another question. I apologize. So your question is with regard to the tier 1, 2, 3. So this is if I understand the system, it's basically breaking up the kinds of services delivered at each tier. And tier 1 and tier 2 are primary and prevention and early intervention. Tier 3 is considered direct client services with the exception of crisis referral. And actual hands-on clinical services are provided by clinicians, not by a wellness coach. And that individual can also parenthetically supervise wellness coaches. Is that helpful?
Laura, did that answer your question?
So we have wellness coaches that work alongside the clinicians.
That's right. And that's the vision we have as well. Yes.
Right. So would the wellness coaches that we have on campuses currently working alongside clinicians providing tier 3 services be eligible for this grant?
They would be, but our certification does not cover it does not recognize tier 3 by, the larger direct service kinds of intervention, clinical intervention. So like I say, a wellness coach is doing prevention and early intervention. That's what they're being certified to do. The grant, we can't tell the difference. And what I'm concerned about, and you need to think about, and we all don't have an answer today, is whether or not Medi-Cal or private insurance is going to cover them under the multi-payer fee schedule, because the fee schedule is designed to do prevention and early intervention. So I again, because we won't know what that final language looks like until January, just be very cautious when you're figuring this out. I wish I could give you more definitive information.
Okay. Yeah, it's just hard knowing as far as sustainability without having that schedule released yet.
I know. We all wish it were.
Thank you.
All right, thank you, Laura. Next question, Lexi, are you there?
Yes, I'm here, and this will be a quick one. Again, on the application, you guys require several documents, letter of sustainability, 501c3, Title I, etc. There's a Head Start verification document. Can you speak to what that is?
Yes. Yes, it's very confusing in the application, the way it works. So it's required of Head Start programs. So if you say you're a Head Start program, it's going to ask you for that letter. It also shows up for other applicants, but you can ignore that request and it will let you move forward in the application. The color of that request looks different for a non-Head Start applicant. And it's a function of the software that we couldn't get around.
Okay, so if I'm not Head Start, then I would not need to do anything with that. Is that correct?
Correct.
Awesome,
Just
thank you.
keep going. Yes. And Michelle, is there anything I should say more about that? You're the expert on this one.
No, you said it good. You said it wonderfully. It's
Okay.
very confusing that when it asks for a Head Start document and they're not Head Start, people are getting confused.
Yeah.
So yeah, they don't need to worry about it.
Thank you.
All right, next question from the chat. Is there a place where we can find all the questions in the application?
Sadly, there is no centralized location other than the application for you to see all the questions.
So what you can do is save your pages as you go. You can fill the fields as best you can and move forward. And you can always go back and amend a field. So nothing is final until you push that submit button at the very end. Michelle,
Can I follow up on that? It's my question.
Sure.
So if multiple people from our organization need to be working on this, for example, the budget part and so on, there's no
Yes.
way for them to be able to see that, correct? So
Unfortunately, no, not without proceeding through the different, answering each question in each of the, I think it's 5 windows, that the whole application.
And what you can do is put in like an anonymous, answer for a particular question. That way you can at least either print it out or you can see what the questions are and then go back and answer them correctly.
okay, thank you.
Yeah. It's one of those lessons learned about how do we solve this for future applicants of our various programs. Thank you.
Yeah.
All right, thank you, Joy, for that question. Is it Kalia?
Yes,
Kalia
Kalia,
Parker?
thanks.
All right, thank you.
My question is also around the logistics of the portal. It said, or the addendum stated to include the names of the orgs that we're partnering with, or LEAs. Where
That's
will we
right.
include that?
Put it in your narrative at the beginning.
Okay.
We've expanded that field to add more content so that you can add those there.
Okay, perfect. Thank you.
Mm-hmm.
All right, thank you. All right, next question from the chat. Is this recording going to be available for us to reference later? Yes, it is. We will be posting this in about 7 to 10 business days on our website, and it will be available.
I also want to jump in because I think we skipped a question, and it's the question is licensed professionals or PPS, and the answer is both. What if the question has to do with supervision? It could be either.
Thank you.
Mm-hmm.
Sorry about that. Okay, let's see. Where are we next? Peter's question. Oh, Joe, you got a question going back and forth.
Just a quick question around supervision. You may have covered this. Do you have any specific requirements coming out or guidance coming out around supervision that we need to look for?
No, specifically, we will not be. And the reason for this is that it's regulated by the Department of Education. It's outside our scope, and the regulations leave it to each school to define that responsibility. I wish I could be clearer. Yeah.
Okay. And is it possible for you guys to link that ed code into the chat?
I'll give it a try.
Thank you.
Yeah. I don't know if I'll get to find it, but I'll do my best.
I will just add that we aren't like experts on what laws apply to each local jurisdiction. So this is part of the reason why we're not defining certification at such a minute level. Is just the complexity of local laws and regulations combined with the complexity of the nuances of each individual situation. So supervision structure is determined by both laws and regulation and the specific context of the organization in which that supervision is taking place, and whatever you're going to be having the certified wellness coaches do. Certain job activities you may want to supervise more heavily or less heavily.
All right, thank you. Okay, so we are at the hour that we had scheduled, but it looks like we still have questions. And so we are going to continue to answer your questions. Want an indication from the crowd, do we still have a lot more questions, or are we getting near the end? That's going to determine whether we're going to take a 5-minute break or if we're going to just try to push through just the last few questions. So if you could enter in chat if you still have lots of questions, let us know, or if you're getting near the end of your question list, please help us know where we're at in the office hour. We want to make sure we get all of your questions answered. Okay. All right. Lanya, go ahead. You've both indicated and you have your hand up. So let's get you back online.
Great job at the pronunciation. You have a great memory. So I have a question. It's about supervision again, because we're defaulting to the education systems to supervise behavioral health criteria, and because this is a brand new thing that we're creating with the wellness coaches, I don't foresee there being any guidance around it for a lot of places, because most supervision is regulated by the Board of Behavioral Sciences for licensed clinicians, a school like a university, or some type of credentialed like school psychologists and things like that. There's very little in the work of behavioral mental health workforce, and only because I've been doing this work for the last 5 years, like this specific work. Is there any regulation at all written or described? And so there was somebody that actually just asked for some more guidance on that. And I would really want to just hear your thoughts around what agency specifically, because I know for a fact the agencies that I'm working with, they're going to look to me and say, Lanya, here's this grant, what do we do with it, right? If that's the anticipation, then of course, but I would probably need to direct them directly to some type of supervision guidance for wellness coaches specifically, since this is brand new. So I just wanted to just elaborate on that a little bit.
Yeah, we appreciate your circumstance, and and we have looked closely, and it is truly out of our reach for us to define this.
Okay. Well, for anyone that has any supervision questions in your local agency, blessings to you on that journey, because I can see it getting a little sticky. Yeah.
All right. Next question from the chat. This is from Peter. Maybe we've answered it, but just make sure that we're good on this one. To be clear, if the COE would like to bring in 5 navigators from the MHSSA grant program, we will indicate that desire when we fill out the grant, even though they are not currently employed by the COE.
you do not have to be employed at the agency now. You can be either repurposing staff that you want to make certified wellness coaches, or you could hire new staff as wellness coaches. What really matters is that they are certified the day you start spending money.
All right, thank you for that clarification, Anne. And then did we clarify this in the last time Peter was on? What if they aren't certified yet? Isn't the grant to assist with the process of getting them certified?
So the indirect cost portion of the grant, the 10% portion of your budget, you could use that to assist if there's a financial need to assist people in getting certified. That's a part of the indirect costs, because a part of the cost of hiring a certified wellness coach is getting them certified. So the very definition of an indirect cost for the purposes of our grant. But the actual employment money has to go toward them actually performing the job of a certified wellness coach.
That's right. And I'll build on what Kristen is saying. The number one thing that you have to include in your application is wellness coaches. So you can't even ask for supervision. You can't even ask for intern stipends. You have to be asking for certified wellness coaches. You may add those things to your application, but certified wellness coaches is the primary expense that we expect in an application.
All right, thank you for that clarification. Cynthia asks, are university health centers eligible for grant funding?
Yes, they are.
All right. Next question, Beverly asks, are there any exceptions to the minimum requirements of an AA or BA for these positions?
No, there are not.
Right. Jill asks, does the funding for a CWC salary benefits calculate for a 12-month period or 18-month period when entered as account into the portal? I think we talked about this earlier, yes?
Yeah, when it's entered into the portal, it's a lump sum for a full year. We reference 10 months in the grant guide because an academic calendar year is 10 months of employment for a lot of positions, but it's an annual lump sum per position.
All right. I'm not sure if this is a question or not, but from Peter, hopefully for your college outreach and broadens beyond social work programs, since more majors qualify psychology, early childhood education. I've been speaking with colleagues at Cal Poly who are not aware of the behavioral wellness coach positions.
When if you could come online to say more, when you say you're talking to Cal Poly, if you're talking about educational opportunities at Cal Poly in the School of Social Work, I assume you mean Humboldt, then that's because we're just starting the process of identifying California State universities who could be part of that program. It's not a part of this grant.
All right. And then Lexi asks, how will we receive funding if awarded? Will we get it all at once?
There's a payment schedule. Well, it's in two parts. It's kind of complicated. So you'll get money every 6 months. There will be 25% advance in the beginning when you are awarded or executed a grant with us. And then every 6 months you bill us for actual expenses that you've incurred, and we reimburse you that with some adjustment for the advanced funding. So funding past the first advance is in arrears.
Okay, so basically we get 25%, 25%, 25%, 25%, and we bill you. Oh, no.
No. So you could get 25% in fall of 24, and then you bill us, say you only get your wellness, 10% of your wellness coaches. Bad example, but if you're short on getting all your wellness coaches in place, you would only get a smaller amount. So it's based on actual costs.
Perfect. So the only thing we're reporting back to you at this time would be the invoices then. There's no other grant reporting pieces.
There will be information requested as part of that report.
Okay, and we'll get more of that if we get awarded.
Correct. We will
Awesome.
announce that as part of that announce of awards. Yes.
Okay.
And I just want to add that on page 7 of the grant guide, we explicitly lay out the payment schedule.
Thank you.
All right, let's see, next question. Did I understand you say that you expanded the narrative to more than 2,000 characters?
Correct.
Let's see, that's the statement.
So,
All right, and
I'm sorry, go
then
ahead, Chris.
I was gonna say, the last question I see on the list is, when will the recording be available? 7 to 10 business days. And that's the end of the chat questions, and I don't see any more hands up, so.
And I'll just hasten to add that Chris says 7 to 10 days, but if we get it sooner, we'll post it. So we won't wait that long if we get it back.
Yeah, we just have to make sure it's ADA
Great,
compliant.
thanks.
Yeah.
And you guys will email that, I assume, right?
We post it to our website, so we urge you to check.
Great, thank you.
And then, Anne, to confirm on the narrative, the number of characters is 2,000, correct? Not over 2,000, correct?
It's 2,000.
2,000, right, okay.
That's what Chris told me.
Right.
Hoffman,
Right.
yeah.
Okay.
All right, are there any more questions out there? This has been a great session. All right, Rocio, go ahead.
Sorry, just to clarify, because I know you want us to list the schools. That is within the 2,000 characters?
That's just the name. So you might say Franklin High School, it might be Franklin HS. So yes, but if you tell us that it's a huge number, then please email us that you have a huge number of participating members of your consortium, and we'll work with you directly.
Okay, thank you.
All right, thank you. Jill, go ahead.
So this is just probably a pie in the sky question, but I know there have been lots of conversations about adding additional areas of study to the qualifications for eligibility. Is this something that would get written into the special plan amendment, or is this something that you guys do internally? Like what is the procedure for something like that?
Say the first part of the question again.
The eligibility criteria for programs of study for certified wellness coaches. Right now, there are certain areas, sociology, psychology. There's been lots of conversation about adding health sciences or behavioral science, behavioral health, like things that aren't yet included in the AA and BA pathways. So what is the procedure for adding other areas? Is that something that gets written into, or is that something you guys decide internally? Like, what does that look like?
It's an internal process, but it's been heavily decided based on extensive stakeholder engagement. And so there's been a commitment made among the array of stakeholders as to ensuring we select programs that have the appropriate coursework and field practicum opportunities.
Okay.
And that's one of the big challenges. You'll notice like psychology and sociology are in the workforce pathway for certification. But part of the reason we could do that is because they're coming in with work experience. That's not true for someone that's just gone to college and applying. They just don't have the field practicum. Those degrees don't offer it.
Mm-hmm. I'll add, Jill, the long-term vision is that all certified wellness coaches that will be certified in the future will be going to programs that we designate as meeting all of the requirements that we've set out through the stakeholder process. So we will have HCAI designated programs, and this will be the supply of wellness coaches going forward. This is just our initial certification process that's meant to bridge us into the sort of final state where we really take a look at all of these individual programs to make sure that despite whatever their name is, be it health science, psychology, behavioral sciences, whatever their facial name is, that they're at their core providing the competencies that we think are important to becoming a wellness coach.
Right.
That's
Thanks,
great.
Joe.
Thank you so much. And I really appreciate all the feedback you guys take and all the questions
Yeah.
you answer. You're just a really great group of people to work with. So thank you.
Thanks,
Oh,
Jill.
thank you, Jill.
So thank you, Jill, for that feedback. And all right, next question, Cesar.
Hi, thanks again for taking our questions and being available a little bit longer. So I have some very specific questions to what we're going to be doing. Is there somebody available that I could talk to one-on-one outside of this so I don't take everybody's time to get those answered, or should I just ask now?
You need to ask now or put it in writing to our mailbox. We can't have side conversations. We need to make sure that we publicly vet all information out of fairness.
Sure, that makes sense. So we have, so I work directly with students, and I do have a master's in psychology and a couple other degrees. But in order to do what I'm doing, we're focusing very heavily on SEL. And I'm trying to figure out how we can implement this grant to really strengthen our coaching programs. And so is this the opportunity to do that, to use this grant money to expand what we're already doing? Or, sorry if I missed this, I'm really sorry I missed this meeting or the bulk of it. Or is this something that you want specifically us to do something specific with the group of stakeholders that we work with? Primarily, I'm working with Hispanic students from the ages of 12 to 21.
So the purpose of the grant is for us to provide coaches to organizations that are eligible, and for those coaches to provide services that we've outlined in the scope of practice for wellness coaches. If what you're doing is in line with that scope of practice, that's something that we would encourage. You can actually read that scope of practice explicitly in our resource guide listed in our resources. We have that explicit scope of practice, and then we also have it converted into a job description for a wellness coach. Obviously, you can tailor that to whatever you're specifically doing at your organization. As long as it's within that scope of practice, that's something that we would endorse.
Okay, so I guess the last part of my question is, I'm trying to figure out is if I become a certified HCAI coach, then I do the work working for one of the organizations, or if I become a certified coach and then I help other coaches get certified in my organization to then do the work. I'm trying to figure out which way that would work best.
You know, it's really your decision who's going to provide that direct service. But the service has to be delivered by a certified wellness coach.
Okay, so irrespective of what we do, I have to go through the certification process first, it sounds like.
Only if you're delivering the service.
The services, yeah. Okay, gotcha. Great, thank you very much. Appreciate
You're
your
welcome.
help.
Yep.
All right, thank you so much. And this will be our last chance for questions. I think looks like we've gone through all of the chat questions, and I see no more hands raised. Ann or Christian, do you have any other last thoughts you want to provide?
I just want to note that we're going to get back to you about the discussion earlier. When you're telling us how many wellness coaches you're going to employ, whether you should scale that to 18 months. We're going to have an internal discussion about this and then get back to you about that. We're also going to get back to you about the use of grant funds while also receiving payment through the multi-payer fee schedule. We're going to discuss that internally and get back to you all.
Thank you, Christian.
Yeah, thank you for saying that too, because as a lot of people have kind of iterated, I think most of us anticipated that we would receive those funds and be billing until the length of the funds ran out. So hearing that once we start billing, we don't get access to the funds is really discouraging.
Yeah. Thank you for your thought, Lexi.
Appreciate that feedback.
All right. Well, thank you all for your participation in the office hours today. Great questions. These interactions really help us make sure that we're providing the best service and value for you guys. And if you do have other questions, please email them to wellnesscoach@hci.ca.gov. And as a reminder, we will be posting the recording of this webinar in no less than 7 to 10 business days. Excuse me, no more than 7 to 10 business days. And you can find that on our website. We do appreciate everybody joining us today to learn more about this employer support grant program. And we really are excited to be able to offer it as part of our health workforce development efforts at HCAI, and are grateful for your participation with us today. We encourage you to go to our website to discover all the great resources that HCAI offers. And as a reminder, this application cycle closes March 15th, so be working on those applications, and we look forward to seeing yours. Thank you so much for attending. And with that, we conclude today's office hours. Have a wonderful day.
Thank you all so much.
Bye-bye.
Bye.